I'm so delighted to be here, everyone. I met Steve, probably 8-10 weeks ago to actually sit down and to get to know one another and start to brainstorm about how we might be able to collaborate on a few key initiatives. So that is the result of me being here today. And I will tell you, I get a lot of questions about why would you leave Arizona State University in sunny Phoenix to come to Columbus, Ohio? And I have to be honest with you, I was not looking to leave Arizona State when Ohio State started to call me. But what made this particular opportunity so exciting for me was this dual position as Dean of the College of Nursing, but yet the university's Chief Wellness Officer. I don't know if you're familiar, but a lot of corporations throughout the country are hiring Chief Wellness Officers because they recognize employees overall are not super healthy anymore. And that poor health, including both mental and physical health, is costing corporations a lot of money because claims are going up. There's a lot of absenteeism that is occurring. So there's a real movement across the nations in corporations to hire chief wellness officers to promote health and wellness across the corporation. Well, our president, Gordon Gee, who's absolutely fabulous, wasn't going to let me say no to this opportunity. He was pretty relentless in his recruitment, but they had a real vision as we talked, Gordon Gee, Steve Gabby, the CEO of our medical center, about what the role of a chief wellness officer could do, working in partnership with key leaders across the university. So today's talk, I'm really going to focus on where we're at with the state of health, both throughout the country as well as at Ohio State University. I'm going to talk about wellness and some of the key initiatives that we have going on in the university to really promote health and wellness system-wide. I first want to ask you a question, and the question is, how many of you have tried to change the behavior of somebody you love? Whether it's put the toilet seat down, squeeze the toothpaste differently, whatever it is. I think we've all been there, done that. And how successful are people usually with behavior change? They're not. They really aren't. But there's more information, more evidence coming out in the literature that visual triggers can help people with behavior change. So I wear buttons a lot of the time as a visual trigger to promote what it is I'm trying to do. And I have to tell you a funny story. I was in Georgia to do a keynote a few months ago at a conference. And I usually take buttons off when I walk through the airport, but that day I left a button on. And that button said, "I love evidence." So I sat down next to a gentleman and he kept staring at my button. And he finally said, "You love evidence. You have to be an attorney." And I said, no, I'm not an attorney. I'm a nurse practitioner, and let me tell you all about evidence-based healthcare and why it's so important for your health. So we had a great 20-minute conversation about that, and when we were leaving each other, he said, "You know what, Bern? I have an appointment in a couple of weeks to see my primary care provider, and when I go to see him, I'm going to ask him, are you an evidence-based healthcare provider? And if he tells me no, I'm going to go and see one." You see, all of us want to see healthcare providers who are evidence-based. And by that I mean healthcare providers that use the best and latest evidence from a body of studies to take care of us. Instead of seeing providers that tell you to do things based on what they learned in school 20 years ago, or that's the way we do it here. I have another button I wear a lot. It says because we always do it that way, with a slash through it. Because in evidence-based practice, we can't think that way anymore. We've got to use solidly grounded evidence integrated with the clinician's expertise and patient's preferences and values to deliver our care. Well, we have a new One University Health and Wellness Council at Ohio State that we've put together, whose vision is really to create the healthiest university, not only in the nation, but in the globe. And people think that's pretty ambitious. You know, that's a pretty big dream. But you've got to start with the vision. And me being in academia for the last 30 years of my career, sometimes we get more caught up in process, if you know what I mean, than establishing the exciting vision and figuring out how are we going to achieve that vision and start running to do it. A lot of times we get focused on the barriers, and it's good to focus on barriers so you know how to overcome them. But it shouldn't slow us down from moving forward in really positive ways. So I was in Florida a couple of weeks ago. OSU has a winter college down there, and I gave a talk on health and wellness for about 220 folks that were there. Well, Urban Meyer happened to be in Florida, and Gordon invited him in to speak for a couple of minutes right before I came on to talk. So I had to get a football slide up there as I talked about catching a big dream, because again, that's really important. This cartoon says, because we know catching the big dream is one thing, but you have to execute. Because dreaming without execution doesn't turn into outcome. And that's what we have to focus on. It's the outcome. You know, the cartoon says, my dad says persistence is the key to success. So I'm going to give you the wrong answer until it becomes the right answer. I'm not going to go away until we really get the dream of where we're going. And I always say, you know, when we encounter barriers, those are just character builders to build us up even more to accomplish what it is we need to do. So instead of having a bad day, I tend to have character building days. And it really tends to help you through those real challenging experiences. Well, do you guys look like this some days? We all do, right? Our students come into class, and that's how they look at us many days, right? There are tons of research studies out there right now that are showing us the evidence that we are a stressed out population of faculty, of students, nurses, employees, physicians. Our level of stress in America is so high right now. And we have to equip our university population, faculty, staff, and students with the coping skills that they really need to deal with all the stressors that they are currently under. Depression and fatigue plague our society right now. And a lot of research really shows depression is a fabulous predictor of poor outcomes, poor health outcomes, poor academic outcomes. So if we can help our faculty, our staff, our students to cope well so they don't experience undue stress, anxiety, as well as depression, they're going to perform better. They're going to be happier. Their outcomes are going to be better. Everybody asked, you know, what's that #1 killer of Americans? And if you ask 9 out of 10 people that question, they're going to tell you cardiovascular disease, right? Technically, that's true, but I like to look at it as behaviors. Behaviors are truly our #1 killer in America, because behaviors do lead to overeating, smoking, lack of physical activity, alcohol and drug use, non-adherence to medications, and suicidal problems as well. So we have a lot of work to do in terms of behavior change. You know, there's tons of programs out there, usually that integrate nutrition education, physical activity, and behavior modification, rewarding ourselves if we exercise 3 times a week or whatever it is. But a lot of the recent studies are showing those techniques, those interventions that we do a lot of the time to help people with behavior change don't really lead to sustainable change in behaviors. And that's what we have to solve. It's how do we get to the sustainable behavioral changes? I have an NIH grant that I'm conducting right now in Arizona. I have 2 more years left on the grant, and it's a cognitive behavioral skills building program that we have implemented with 800 adolescents in the Phoenix and the Tempe school districts. And we're looking at, can this program improve physical health outcomes, healthy lifestyle behaviors, mental health, and academic performance of the teens? Well, we've also developed a course we did at Arizona State that we're looking to start here at Ohio State called 5 to Thrive, focused on 5 particular areas to help our students be very successful, that incorporates cognitive behavioral skills building, nutrition education, physical activity, as well as coping skills and relaxation. We could produce the best and most competent students to go out in the workforce. If they're engineers, if they're social workers, if they're nurses, if they're physicians, so they might go out and be so competent at what they do for other people in the workplace. But if they don't know how to take care of themselves and lead a healthy lifestyle, have we given them all that we should have throughout their educational process? Well, here's a cartoon that epitomizes American children's behavior. You know, they say kids these days are overweight because we don't get enough vigorous exercise. Maybe we should chew these potato chips a little bit faster. And honestly, kids are going to eat what is brought into their homes. If it's there, if it's unhealthy, you're going to reach for that because that is what's available. And I learned this morning that a substantial portion of the students at the Mansfield campus, they do come from lower socioeconomic backgrounds. So they might not have great environment availability of healthy food sources. So these are all important considerations as we plan wellness programs, because you have to implement wellness programs considering the context of the community in which people really live. Well, as both a pediatric nurse practitioner with an adolescent and college youth subspecialty, as well as a mental health psychiatric nurse practitioner, I have integrated mental with physical health care for many years of my career. One of the biggest challenges we have in our country right now is the continued separation of physical and mental health care services. Because so many times we're seeing comorbidities exist. If somebody has hypertension, a lot of those folks also are depressed or they have anxiety problems. We have to deliver integrated healthcare services, both mental and physical health care, because if we don't get to the mental health issues of depression or anxiety, what's the chance of people adhering to their treatment, to their medications? You will see coming out federally right now, the government, NIH, the Agency for Healthcare Research and Quality, they are putting out grant opportunities to encourage healthcare systems to integrate mental with physical health care. The World Health Organization predicts that within the next 20 years, depression will be the second most impairing illness worldwide. I mean, the time is urgent. We have to put a sense of urgency on dealing with mental health problems that are affecting our society because they really are very, very prevalent. 1 out of 3 to 4 children have a mental health problem, yet less than 20% get any treatment whatsoever at all. I was 15 years of age when my mother sneezed, burst an aneurysm, and died right in front of me when I was home alone with her. You can imagine what you'd suffer from for the next few years as a 15-year-old who witnessed your mother dying right in front of you and you felt helpless. You couldn't do anything to help her out of that situation. I lived with severe post-traumatic stress disorder for 3 years after my mother died. I didn't sleep through the night for 3 years. Night sweats, chills, hyperarousal, all the time. My family member took me to our family physician. This was back in 1973, about 8 months after my mom had died, and said, please do something to help her. She can't sleep. She's anxiety-ridden. She's startling. What my provider did, wrote a prescription for Valium and said, give her one of these at night. She'll sleep through the night. She'll be fine. I took 1 Valium and was groggy the next morning and said, I'll never take one of these again. I just have to gut it up and get through this. I will tell you, that was 73. The health care, the mental health care services in our country are really not much improved since then. So when you see so many of our kids suffering from things, and they're given pills, an SSRI for depression, for instance, by their family providers, but they don't get evidence-based treatment like cognitive behavior therapy, which the evidence shows is the gold standard for people suffering from mild to moderate depression. But because we lack so many providers throughout our country again, people are not receiving the evidence-based treatment that they really need. What was really sad too about my mother's unexpected death, after she died, my dad was cleaning out her purse. She finally went to our family physician a week before she died because she was having headaches that were pretty severe. She had a prescription in her purse for an antihypertensive agent that she never filled. So again, when you experience things like this, you get even more passionate about this whole area of wellness, prevention, making sure we get people the best evidence-based treatment that we can get them. Well, 1 out of 2 people in this country also have a chronic illness. 1 out of 2, and 1 out of 4 have multiple chronic illnesses. The Institute of Medicine just put out a new document called Living Well with Chronic Disease, because wellness shouldn't only be for healthy people. If people are healthy, of course, we want to keep them healthy. But we need wellness programs to transcend whatever state of physical health that a person is in. And when I talk about wellness, I even talk about people who are at end of life. How can we help them to live the last days of their life in the highest quality of wellness that we can get them? Well, here's the state of our health at Ohio State University, and these are the latest figures that we have. So almost 60% of our faculty and staff are overweight and obese, so almost 60%. We pretty much so mirror what the figures are for the whole United States population at Ohio State. About a quarter of our employees have elevated cholesterol levels. Almost 50% of our employees have a derived stress index, meaning they hit the cutoff score for high stress. About 16% of them have a derived emotional health risk, and about 5% of our employees smoke. I was up at Cleveland Clinic some months ago to talk with Toby Cosgrove, who is the CEO of Cleveland Clinic. And all of you, I'm sure, have heard about everything Toby has done in the Cleveland Clinic regarding wellness. He won't even hire people who smoke. And to make sure they don't, a month after they start employment, he makes them take a nicotine test. And if they're positive, they have to go through a smoking cessation program. So he's done radical things at Cleveland Clinic, but they have superb outcomes in terms of improving the health of Cleveland Clinic's employees. Our students, the latest data is about 54% of them report having more than average or tremendous stress over the last 12 months. A higher percentage of graduate students, and student life, we have our wonderful VP of Student Life here today, Dr. Javon Adams-Gaston, as well as Louise, who heads up our counseling consultation. It's really a wonderful, wonderful program that helps so many of our students. But we're here today to talk with Steve about also how can we bring health and wellness here to Mansfield campus for the students, the faculty, as well as the staff. Almost 52% reported feeling overwhelmed in the past 2 weeks, and an additional 17% of these students reported these feelings in the last month. And these students, you might think, oh, students don't recognize how much stress, anxiety, and depression interfere with academic performance, but they do. They really do. Remember the course I told you about that we started when I was at Arizona State, that 5 to Thrive? We actually did a research study following those students who took the course compared to students who didn't. We had substantial drops in depression, anxiety over time, but interestingly enough, the students, the freshman students who took that course, they came back the following year. So there was a higher retention rate of those students than students who had not taken that particular course. And then how many of you have heard of the freshman 15? Well, the freshman 15, which is 15 pounds of weight that's gained during the freshman years, that's not actually based on good data. So the data that we have shows the average freshman gains about 4 pounds. And a lot of people say, well, that's not so bad as the freshman 15, but if they're gaining 4 pounds every year, by the time they get through college, that is an issue. So the nutrition, the foods that we provide our students, their levels of physical activity are really, really important while they're here academically with us. Isn't it uncanny that the U.S. spends almost double in healthcare than other industrialized countries, yet we rank 37th in performance? I was over in Switzerland in January. It is amazing there. They have very few Swiss who are inactive. You see bikes everywhere. I mean, even in the wintertime, people walking. The physical activity level over there is great, and they spend much less money on their healthcare costs because they have healthier populations. Healthcare costs over the past 4 years for college employees have increased 5 to 11%, which is not sustainable in our healthcare system. 3% of our patients account for 50% of our healthcare costs. I was at the White House 2 weeks ago. We were strategizing about how to keep advancing this Million Hearts campaign. And it is absolutely amazing to talk to cardiologists from all across the country in terms of their views on this, what we have to do to improve, again, these healthcare costs. But the White House staff were talking about, isn't it going to be wonderful when 33 million more Americans have access to health care in 2014? And you know what? I get chills up my spine when I hear that. I think it's fabulous to provide everybody with health care, but we don't have enough health care providers now to service people who are insured. 70% of Americans cannot get same-day appointments with their providers. What's going to happen in 2014 unless we have a major increase in the numbers of healthcare providers that we are producing? We're going to have serious more medical errors. Have any of you here experienced a medical error for yourself or your family members? Some of you are shaking your heads yes. 1 out of 10 people admitted to the hospital experience a medical error. And if you experience a medical error, 5 to 15% of you will either die or have permanent disability. That's how serious of a situation we are in with our healthcare system. Now, I didn't bring you here to depress you this afternoon, right? But I think it's critical to talk about these issues so that we can communicate more, raise awareness more, be better advocates to our legislators about what is needed to improve the health of our students, our faculty, our staff, the people of Ohio. Super important. Patients only receive about 55% of health care that they should. That's it. And ironically, only about 20% of health care that is delivered is evidence-based. Leaders will cite that all throughout the country. It takes, on average, 17 years to take findings from research and implement them in clinical practice to improve care and outcomes, if we're lucky to get them implemented into clinical practice. Poor quality health care costs us billions of dollars every single year. We waste so much money in the healthcare system. We overtest people to death when it's not indicated. I had the privilege of serving on the United States Preventive Services Task Force the past 4 years. And that's this body of 16 people throughout the country that really creates evidence-based guidelines for physicians and nurse practitioners. What we know, though, we can create all these guidelines, but information only, the dissemination piece, doesn't change providers' behaviors. So again, we have so many providers across the United States that are doing things with patients that aren't evidence-based, that lead to, again, wasteful healthcare spending. Well, I'm a big proponent of evidence-based practice. I talked about that earlier in my talk. And it's combining the research evidence with our clinical expertise and patients' preferences and values to make the best decisions. This is my youngest daughter, Caitlin. She's now 18 years of age. She is a competitive equestrian. She's a freshman at Arizona State University, but according to Gordon Gee, not very long, because he's calling her. He's called her twice already to say, Caitlin, you need to come to Ohio State to be here with your mom and dad. But Caitlin wants to be a veterinarian, so I'm hoping in a couple of years she'll be in Buckeye Nation with us, going to vet school. She almost died in Australia 8 years ago from a ruptured appendix. And even though me as a pediatric nurse practitioner, Mom kept telling the providers over there, I knew what the problem was, please do a simple ultrasound of her belly, nobody would do it. Thank heaven for the pediatric nurse over there, and this went on 10 days. Technically, she should have died from widespread septicemia. When they finally listened and got the ultrasound, she showed a big abscess in her belly. She was then into full-blown peritonitis, pelvic sepsis, and almost into full-blown septicemia. They called in a public surgeon who talked to me and my husband and said, Caitlin is way too sick to operate. What we're going to do is put her on triple high IV dose antibiotics for 6 weeks in hopes that the body will wall the abscess off, and then we'll go in and do an elective appendectomy, take what's left of the appendix out in the abscess. She would have died. Thank heaven for the pediatric nurse taking care of her, who said, this is socialized medicine over here, Bern, in Australia, but what you have a right to as an American is to call in a surgeon, a private surgeon, for a consult. And I said, get me the best one you have. Ellen DeCostas came in, took one look at Caitlin, and said, if we don't get her to OR in the next couple of hours, she's not going to make it. They flushed her peritoneum for 2 solid hours just to get all the pus out. The good news, we brought our little girl home alive. The bad news is she had so much damage done to her fallopian tubes that they're not very optimistic that she will be able to have children on her own. Now, that all happened because they weren't practicing evidence-based health care, and they wouldn't listen to me as a seasoned nurse practitioner who knew what was going on with my daughter. But you know what? This happens all the time here in the United States, that we're doing things based on tradition or because we've always done them that way, instead of taking care of people with the best evidence and listening to our patients and our family members. So these are some of the areas being identified by the federal government that are in serious need of innovative solutions. Our mental health care, cancer screening, prevention and treatment of overweight, obesity, diabetes, access to care. The disparities that we have in this country are just frightening. They really are. And then lastly, we gotta figure out, once we produce the evidence through research, how to move it into practice in the quickest ways. Not this 17-year time gap between producing the research evidence and the implementation into practice. Well, we all know healthy and happy workers are the productive workers in our institutions. And if you haven't seen this document yet, I'd encourage you to Google it and read about nationally the prevention strategy that is being rolled out. Wellness is now a very high priority. The problem that we've had with funding prevention is you usually don't see the good outcomes for a lot of years later. So it's not instant gratification. You've got to be patient. But now everybody's realizing we need to up the funding for wellness and prevention in order to deal with all these adverse health outcomes we are seeing. So I just want to remind folks as I end this talk in the next 5 minutes or so, wellness encompasses all of these dimensions. So it's not just about physical health. It's mental health, it's spiritual health, it's environmental, it's workplace, it's financial. And according to the studies coming out now, for every dollar that we invest in wellness, our return on investment is $4. So a couple of the things that we are doing at Ohio State, I mentioned we formed a One University Health and Wellness Council. This council is really existing to provide the overall vision and coordination for wellness initiatives across the university. So often we do so many wonderful things, but we do them in pockets or in silos. And we need to come together so we learn about everything being done at the university, which is wonderful, but we have a way to coordinate those efforts as well as to advance them. I'm sure you've heard about the three new discovery themes that we will be launching soon at the university. The first one is going to be health and wellness. So the university, pending board approval, is going to allocate substantial funding into this area of health and wellness. And Lonnie King, the dean of the vet school, myself, and Steve Gabby will be heading up that health and wellness discovery theme. So you could see how much emphasis the university is really placing on health and wellness. So we've got a big vision at Ohio State, again, to be the healthiest university in the globe. And we're going to do that through a sustainable impact on all these particular areas. Our mission is really to make wellness viral through all our academic units. Just make it viral. It's in our DNA, everybody's DNA. We're going to promote the highest level of wellness with innovative execution tactics, and we're going to base what we do where there's good evidence on that evidence. And when there's not good evidence, we're We're going to generate the evidence that can be rapidly implemented into real-world settings to improve health and wellness. So these are just some important tactics for moving forward. Our One University Health and Wellness Council will have our next meetings where we will be working on a university-wide strategic plan for health and wellness. We started a new onboarding process for faculty just last week. So not just for faculty rather, but for every employee at OSU. So when you come on to OSU, you onboard through wellness. You get a personalized health assessment, you get your blood work drawn, you face your true story of where you're at on that blood work, and we assign then health coaches who can help you to overcome some of the challenges that you face. We've started Buckeye Wellness Tips that go out in OSU today based on the best evidence, and we're now putting together Buckeye Wellness Tips that will be distributed with lots of wonderful tools as well as sources for people to get healthier. At my college in particular, Gordon's been telling everybody about this. He's like, do you know Bern put in treadmills in her college? So I put in treadmills, they face each other so people can have walking meetings instead of sitting meetings. And I also just purchased 12 ball chairs. So people are sitting on balls because you expend more calories when you sit on balls and you strengthen your balance. We're doing standing meetings. We do chair massages regularly in my college, but I'm really focused on creating the culture, the context for wellness that people can really succeed. We have to listen to what people want. That's really important. And we've also launched, in collaboration with Johnson & Johnson Corporation, a 2-day athlete program. We put 40 faculty and nurse leaders from the medical center through this program. We're going to be expanding this even more into the months that come. Maybe it won't be for everybody, but I keep talking about a menu of options that people can choose from, because not everybody's going to respond to the same thing. I get about 250 to 300 emails a day. I don't want a health coach who sends me email messages 2 and 3 times a day because I'm already overwhelmed with emails. But if somebody calls me, that's going to be more effective for me. So we have to remember, you work with people in a tailored fashion and create the culture. We've got to make it easy, engaging, and fun. And we have a couple of wellness firsts for Ohio State, which are really cool that I just want to end the talk by telling you about. We're the first university with a chief wellness officer. And we've been getting a lot of attention for that recently. I think there's going to be many more universities now following suit with that. We're the first university to partner with the Centers for Disease Control in the Million Hearts campaign. That campaign is all about preventing 1 million heart attacks and strokes in the next 5 years. And then most recently, we are the first university in the country to be accredited by US Healthiest as a healthy institution. In June, we will be getting the other 10 corporations, including Target, together for a big public forum on what we are doing to improve health and wellness with US Healthiest. And the 17th Surgeon General, Richard Carmona, will be there to speak at that particular event. So this is the last story I'm going to share with you. In Arizona, My college ran a bunch of health centers where we integrated physical and mental health care. And every year we held an event. It was called Art for Health, where young artists in Phoenix would come, they'd display their paintings, they'd sell them. Half of the profit went to the young artists, half went to our health centers. Well, when I walked in, because I'm always talking about the dream to people and how we have to get a team dream together before we can be successful, a lot of people said to me, Bern, there's an artist who created a painting just for you. Because you all have heard of that one bite of the chocolate elephant at a time, right? When you're embarking on something big. Well, now I have a healthier version. So I walked around the display. This painting is this big. I'm not kidding you. It's very small. And I picked it off the wall because of course I'm going to buy it, because that's my big theme is you got to dream big, execute one bite at a time. I took off the price tag from the back. It said $600. And I said, boy, that artist had a really big dream when she put that amount of money on that particular painting. But really, the bottom line is we need your help. We need to be a team. We need to have an exciting team dream and vision, and then we got to execute like crazy based on the best evidence until we succeed in creating the healthiest university in the globe. Thank you.